After 2.5 years, British Columbian nurses who were terminated for not being coerced into receiving 2 COVID jabs back in 2021 have finally received the outcome of their lengthy struggle to have their union fight to help them get their jobs back. Spoiler alert, the answer to whether or not they will be allowed to go back to saving lives heavily relies on the province's unelected, yet oh so powerful public health officer, Dr. Bonnie Henry.
They have initiated a cycle that had great consequences on people. And there were legal requirements that should have been provided to those people that have been totally ignored.
Drea, Humphrey here with Rebel News. And do you remember back in 2020 when around 7 p.m. people would go out their windows and bang on pots and pans to pledge allegiance to the brave medical professionals who showed up to work despite a declared COVID pandemic and the mass hysteria that came along with it? Now, terminated registered nurse Corinne Mori, who used to help save lives in ER rooms in BC's interior, and whom you'll hear from later today in this report, was one of those highly respected. That is, until the state and their choice media flipped the script on these medical professionals, and suddenly the pseudo-support seen during the pot-clanging movement became non-existent as headlines chose to vilify thousands of BC nurses and other COVID jab-free medical professionals as harmful anti-vaxxers that had become a nuisance to the healthcare system, well, according to public health lord Dr. Bonnie Henry.
And I have very little patience for people who aren't immunized in healthcare. And that will be, we've had a vaccinator mask policy for influenza. We will have a very similar policy that if people choose not to be immunized and you work in the healthcare, then you will not be able to work in certain settings without taking additional measures. There will be consequences for that.
With smugness like that, it's not too surprising that Dr. Bonnie Henry remains the only PHO in the entire country that hasn't dropped her COVID mandate against healthcare workers, even though her orders are linked to critical staffing shortages that put British Columbians in risk and qualified nurses like Mori losing livelihoods and often their dignity. But it's not just Dr. Bonnie Henry and the NDP government that the discarded nurses feel have failed them. Many nurses also feel the BC Nurses Union, who is supposed to protect their employment rights and pay, has as well. Today, Corinne Mori, who has taken on a leadership role for nurses who were terminated due to mandates in effort to get them the legal representation they deserve, explains what the slow-acting union has recently informed them of. After waiting to finally have an arbitrator, the BCNU and Health Employers Association has drafted a consent agreement, one that heavily relies on the decision of the province's mandate-loving Dr. Henry, and that many nurses feel is not good enough.
So they came up with an agreement that was not even something that the arbitrator participated in, and they came up with this decision that if by January 31st, 2025, the public health order is either rescinded or amended, then the nurses who have been affected can be rehired. All of the vacation, severance, all of the things that were never given to us will then be given to us. But if the public health order is not rescinded or amended by January 31st, and it is amended or changed by March 31st, then it is up to the employer if they want to rehire us. So this decision very much reflects that the enforcement of our legal representation is going to be totally dependent on the election results in the fall and who is in power in the provincial government, because that is what this decision is catering to, political influence.
And did they give any type of insight as to where they're getting the date for? Why January 2025 versus another time?
We find this decision very interesting because the details of it are actually, they went into the constitutional argument, which is not at all really what their jurisdiction is. Their jurisdiction is the collective agreement, and that legal agreement between workers and the employers was constructed and agreed on, and they breached it. So it's like they're not even dealing with the actual legal agreement. They have now started incorporating constitutional arguments into it, which is not even their jurisdiction. It's all very sketchy.
If now is not the time that you start to believe in the importance and the value of vaccination in protecting people, then I don't know when is. So if people are in our healthcare system and not recognizing the importance of vaccination, then this is probably not the right profession for them.
Now, I see that if Dr. Bonnie Henry decides to come back to reality and drop this mandate, you guys will get your seniority back, you will get your vacation time back, but I noticed you would not be getting back pay, or at least there was no mention of it. What's the word of the nurses who this has affected? How are they feeling about this? And do they feel like they were represented properly by the BC Nurses Union?
There is something called employment law, which still supersedes the agreements that a union and an employer will construct. And the employment law dictates what is supposed to happen when somebody gets terminated. They're entitled to severance, they're entitled to payouts, and in our case, there has been nothing that has been given. And as a result, nurses have had, like I said, have had to leave the province in order to get worked if they want to continue nursing. So how is this an offer that is even something that is viable or legitimate for those who have lost their livelihoods to say, oh, well, you can have your job back if you want? They have initiated a cycle that had great consequences on people. And there were legal requirements that should have been provided to those people that have been totally ignored. And now this is the solution that they are going to bring up. And they're bringing this up because they know that they have created a situation where they are liable for a lot of money payouts for initiating illegal actions against employees. And so here we have this resolution where they are trying to offer something up, but they are totally skirting the fact that there are legal protections and nobody seems to be wanting to enforce them.
Well, speaking of lots of money and whether or not the terminated nurses are getting what they deserved, I've interviewed a man named Lex Acker. He is a chartered financial analyst who specializes in finding inconsistencies in financial report. And he has some concerns about the BCNU and whether or not they're even able to properly represent you guys.
I've reviewed the last 5-6 years of financial statements of BCNU. And I found a few very disturbing aspects of this. The most important one is, since 2009, roughly, the province is contributing 1% of nurses' wages to an internal fund at BCNU. That internal fund is called the Retiree Benefit Fund, right? So 1% of nurses' wages in 2022, that meant a contribution of $35 million coming from the government going into BCNU. The problem with this is that BCNU has not dispensed of these funds in any meaningful way. So it means that retired nurses are not getting they're not getting any meaningful amount from these contributions, less than 10% for sure. So it means it's accumulating. And at the end of 2022, that balance was $424 million. By 2024, we're at $500 million, $500 million of public funds going into BCNU with no effective purpose, right? So that looks like a huge problem to me. For example, and in terms of revenues, BCNU in 2022 collected about $60 million from member dues and $46 million from the government. So that's a huge amount from one pocket. So the government is exercising lots of influence on BCNU here. And I read the BC Labor Relations Code. Section 6.1 states that an employer or an agent of an employer is not allowed to financially contribute to a union, period. And here we have like money since 2009 from the government going into BCNU. So in my opinion, like that explains why BCNU, it looks like BCNU is having a very hard time like giving a fair representation to their terminated nurses. Now, with like nearly like $500 million on the balance sheet of BCNU, given like the current circumstances, the obvious thing for me to do, in my opinion, is to give that money as back pay to terminated nurses. And that would solve the problem of the terminated nurses. It would solve the problem between BCNU and government. It would also solve the problem for Adrian Dix because he knows about it. He's been briefed in 2018. I have an email that shows it. That's the story.
Let's talk about the numbers that British Columbians were given as far as how many healthcare workers or nurses specifically were let go. At one point, we were told 5,500. Then there was the push, the heavy coercion. You better take those 2 jabs or else. And then we were told around 2,000. What, if anything, are you aware of is the actual number of nurses that were likely to be impacted by this mandate?
So we're including both those who resigned because they didn't want to go through a termination, those who took early retirement. It appears that at the beginning, we lost 10% of our workforce, and that has continued on. So I've had nurses who just even a few months ago were terminated. They were on leave, they came back, they're terminated. So this is still going on.
I reached out to the Minister of Health office to get some more answers and to get a final number on the nurses that were gone. I was told they were working on it for me, and then silence. So I also asked Lex Acker as well to crunch the numbers, and he came up very similar to the amount that you're estimating as well.
With respect to the number of nurses terminated as a result of the COVID mandate, around November 2021, Adrian Dix told the press, told the public that it was between 2 to 5% of healthcare workers who were unvaccinated. And I've reviewed the annual reports of BCNU. In the annual reports, BCNU, they show membership by seniority. So we have seniority tranches, like 5 years or less of seniority, 5 to 10, 10 to 15, and all the way to 25 plus years of seniority. So I've got this distribution from their annual reports. And what I found is like in the group of nurses of 10 years or less of seniority, it's rough. It's nearly like 5,000 nurses were gone, were no longer members between 2022 and 2021. So we can see this is the effect of the COVID vaccination mandate on nurses. It's clear.
I also reached out to the BCNU to get some information from them. I have not heard back. But this is not the end of the road as far as the nurses advocating for the right to have bodily autonomy and still serve patients that you train so hard to serve. What's next for you? I know you're running as an independent MLA in Kootenay Central. Tell us just a little bit about that before we part ways for today.
I see that right now our current system management within this province is turning more into a managerial state than it is a democracy. And we are encountering issues now where the public is having less and less say on the decisions that impact them. And we are having government decide for us. And it is just becoming increasingly larger. It's becoming more expensive. And we are now seeing that government is putting more money into itself than it is into what we as the people need to be able to utilize to have the lives that we used to have. So I've been looking at this, and it's like we need somebody back into our political provincial levels that are actually committed to protecting people. And in my area, rural BC, We are really losing our access to those resources, and we need somebody to protect what we should have. Now, in terms of a political party, all I can say is it doesn't matter what party it is, there is always an element that they will have to take care of themselves before the people. It's just part of it. And I am somebody that needs to be able to speak out. I need to have that ability to do that. And so here I am. I've discovered I'm a bit of a fighter, and I am totally committed to making sure that the collective is represented and that we actually receive the resources that we are paying into.
Well, there you have it, Corinne Mori. You can find out more about what she's up to, as well as more of the numbers that Lex Acker has been crunching in the written article for this report, which is linked in the description box below. Thank you, Corinne. Drea Humphrey with Rebel News.
At Rebel News, we've been bringing you the other side of all things COVID since January 2020, but we couldn't have done any of it without you. If you appreciate the news that Rebel News brings you, consider being a part of making it possible in a very fun way. Go to rebelnewsstore.com and shop. Whatever you buy there supports our independent journalism and also keeps us going strong. And you can use coupon code DREA10 to save while you're there.